TCM podcast, all about Chinese medicine. Welcome to a new episode at Traditional Chinese Medicine TCM podcast. Today we are going to talk about alcohols, in particular with the healing with alcohols and traditional Chinese medicine, wines and liquors. It is a topic of high importance because many people misjudge it and misuse it. So I would like to use the opportunity to explain it in details. And for that, we have to mention several physiological data. For instance, high carbon dioxide levels cause acidosis and stimulates the respiratory centers in the brain, triggers the newborn to take a breath. The first breath typically is taken within 10 seconds of birth, after mucus is aspirated from the infant's mouth and nose, in order to make the first breath after the umbilical cord has been cut. It is the most important level of CO2. If there's too much carbon dioxide in the baby's bloodstream, it can produce hypercapnia and may upset acid-base balance and cause a range of problems. On the contrary, a decrease in alveolar and blood carbon dioxide, which is CO2, levels below the normal reference range of 35 mmHg is known as hypocapnia. Balance of CO2 level in bloodstream activates the very first breath in newborn babies. Too much CO2 will cause permanent damage to the brain, while too little CO2 will not trigger breathing. Following this logic, we can understand that all kinds of stimulation can have the very same effect on the human body. One cigarette a day is great stimulation for our metabolism and causes faster blood flow and brain's functions, such as enhancement of motor learning, while more cigarettes cause brains and body decrease, hyperfunction, and cause a variety of damages to the health. It is the same for alcohol. Moderate to a little daily usage of alcohol even can have health benefits. And talking about alcohols, in various forms, are used within medicine as an antiseptic, disinfectant, and antidote. Alcohol is also one of the oldest beverages used by humans, which preparation dates back to as far as 8000 BC. Alcohol was used as a general anesthetic since 8th century BC, while has been used as an antiseptic as early as 1363. Alcohol is a central nervous system depressant and can slow down brain activity, change mood, behavior, self-control, and can affect coordination and physical control. What are the benefits? There are several. But first we have to make conditions for alcohol to have a benefits, which has to be taken moderately, and itself can reduce cardiovascular diseases, can reduce the risk of developing rheumatoid arthritis, and can prevent stroke. Moderate consumption of alcohol can reduce the risk of developing diabetes, cancer, dementia, and Alzheimer's disease. Moderate alcohol consumption reduces the incidence of the common cold among non-smokers, but has no protective effect against the common cold in smokers. I'm talking about the researchers so far. Moderate consumption of alcohol may prolong life and promote health and well-being in general. We drink alcohol generally during various social events, when people are connected, when they feel further stimulated and sedated by alcohol. In general, alcohol can make people happier if consumed moderately. Therefore, medium consumption of alcohol can be found to benefit our physiology, emotions, or even our social dimensions. So, effects of alcohols are different from person to person, and it depends on a variety of factors, such as epigenetics, individual physiology, frequency of alcohol intake, age, health conditions, food digested before alcohol consumption, speed and amount of alcohol intake. There is no consensus what is the exact amount of moderate consumption of alcohol. However, for most women, moderate drinking is no more than 1 standard drink a day, while for most men, moderate drinking is no more than 2 standard drinks a day. And yes, there is a pretty wide history of usage of alcohol in old China, and they call it medicinal wines. Since the Shang dynasty, which was 1766 to 1122 BCE, the knowledge and practice of winemaking got sophisticated and spread across China. The earliest written record of winemaking in China comes from the Warring States period. It was 476 to 221 BC. Records describe the first emperor of China enjoying wine. During the Zhou dynasty, 1122 to 256 BC, a government body was established in charge of wine production and testing quality using 6 quality factors in order to produce high-quality wine, for instance, pure water, high-quality raw materials, adequate tools and materials, and right processing methods. In the Western Zhou dynasty, 1122 to 771 BC, it was established practice of medicinal wine production and the degustating in the emperor's palace in order to protect health and to cure illnesses. Nowadays, medicinal wines in China are standardized, clinical tested, and are included in the PR China Medicinal Pharmacopoeia. And we have to mention several, classifications. There is official wines and liquors classification in China, and there are several different types of wines and distilled spirits used for making Chinese medicinal wines. And usual categories are as follows: yellow wine or huangjiu, which is made of rice of millet, similar to Japanese sake. Rice wine is a type of huangjiu with pure aroma and a clean taste. The most famous huangjiu is Shaoxing wine. The second one is the red wine made of grapes, or putaojiu in Chinese. The third would be white alcohol or baijiu, which refers to any distilled grain alcohol. The fourth categories would be clear alcohol or gao liangjiu, made from sorghum. This is a type of baijiu. The most famous Gaoliang liquor is Maotai, from the town Maotai in Guizhou province. In general, several authors agree that there are 2 types of alcohol used to make Chinese medicinal wines: rice wine and white alcohol. And these medicinal wines and liquors in traditional Chinese medicine are used very widely, because word medicine in Chinese contains the butyl radical alcohol as a component in its lower half. The butyl radical itself represents a bottled wine with wine in it. This character shows that the use of medicinal wines is ancient and integral part of traditional Chinese medicine. TCM classifies alcohol as bitter, sweet, and acrid in flavor. It is warm in nature and toxic. It enters the meridians of the heart, liver, lungs, and stomach. It opens the blood vessels, warm cold qi, and promotes spleen function. In clinical practice, alcohol is mainly used to treat rheumatism, contracture and spasm of the sinews and vessels, and general pain. Small amount of alcohol support the spleen, but large amount easily damage the spleen. Small quantities quicken the blood circulation, while large amounts are poisonous. In Chinese medicine, there are 2 basic ways of making medicinal wines. The first method is to ferment the ingredients, and the second method, which is simpler, means to soak ingredients in alcohol in order to make a tincture. Of course, there is a very famous traditional Chinese medicine wine therapy, which has, in fact, several different categories of Chinese medicinal wines, such as I would say the first category would be medicinal wines for the treatment of various deficiency conditions, commonly seen among elderly or chronically ill. Second would be medicinal wines for liver and kidney nourishment and thus strengthen the sinews and bones. The third would be spelled wind medicinal wines for treatment with wind dampy or rheumatic and arthritic conditions. Fourth would be clearing heat and disinhibiting dampness medicinal wines for treatments of inflammatory conditions due to damp heat. The fifth will be fortifying the spleen and harmonizing the stomach medicinal wines for regulation of digestion. Six, gynecological medicinal wines. Seven would be external medicinal wines for dermatological problems, injuries caused by wind. 8 would be medicinal wines for treatment of epidemics. 9th, traumatic injuries medicinal wines. And the 10th would be medicinal wines for all types of skin rashes. So, in general, medicinal wines are mostly used during the winter months and also by older patients because they are more concentrated and potent than decoctions and pills. About Chinese medicated liquors, the active elements that compose Chinese medicated liquors are soluble in alcohol, which is the base material for the medicated liquors. For example, Renshan or ginseng, Radix ginseng, is commonly used to help resist senility. It reinforces immunity, regulates internal secretions, promotes the synthesis of proteins, strengthens resistance to fatigue, resists myocardial ischemia, reduces blood sugar levels, and enhances the hematopoietic function. Huangqi or Radix astragalus in English reinforces immunity, strengthens muscle contractility and the capacity of stress reduction and reactions, promotes the synthesis of protein, dilates blood vessels, and decreases high blood pressure. Linger or Ganoderma, Latin Ganoderma lucidum japonicum, strengthens immunity and tolerance of oxygen deficiency, resists myocardial ischemia, and regulates the metabolism of nucleic acids. Dangue or Angelica sinensis herbs increases blood production, strengthens immunity, reinforces muscle contractility and body resistance to cold, protects the liver, increases the volume of blood flow in the heart muscles, resists myocardial ischemia and arrhythmia, hinders the accumulation of blood platelets to prevent thrombosis. And several more herbs are used basically in medicinal wines, such as Herschel, Wu, or Radix polygon in multiflora, which resist atherosclerosis and myocardial ischemia, strengthens cellular immunity, and checks lipid peroxide. Guoqi zhi, which is fructus lychee, decrease blood sugar and cholesterol levels. Also very useful for atherosclerosis and the protection of the liver. Shanja or fructus crataceae lowers high blood pressure and blood lipids, resists myocardial ischemia, and promotes digestion. And Juhua or chrysanthemum or floss chrysanthemum increases the volume of blood flow in the coronary arteries, resists myocardial ischemia and thrombosis, and contains selenium. As we see, medicinal liquors are sorted into medicinal liquors of animals, of the herbs, medicinal liquors of animals and herbs, and medicinals of minerals. Glass bottles with polished mouths are often selected as containers for holding medicinal liquors because they are airtight and can prevent ingredients from oxidation. Generally speaking, the medicinal materials, when soaked, take up to 1/3 of the whole medicinal liquor. The medicinal liquors should keep indoors at normal temperature, be airtight, and avoid sunlight. Shaking the bottle several times per day is called the cold maceration method, which is the most commonly used method. The medicinal liquors can be used when their colors cannot darken anymore, which means the exudation of effective ingredients has finished completely and the consistency has reached the highest level. And the important part is to understand how TCM view of excess usage of alcohol. From a TCM point of view, drinking large amount of alcohol creates excesses in two areas: heat and dampness. Basically, alcohol is a diuretic which causes the elimination of water. Chinese medicine considers that the removal of water from the body causes the appearance of fire, excess heat, so-called. Alcohol raises the heart rate, increases circulation, and creates feelings of warmth in the body. As a result, it can lead to conditions like sweating, flushed complexion, inflammation, loose stools, or scanty dark urination. Alcohol consumption also causes excess dampness. It manifests due to adding more fluid to the body than is necessary, and that fluid needs to exit the body. Because excess dampness makes water imbalance in the body, it often creates a swamp-like state in the digestive system. Common symptoms include fullness, bloating, excess gas, and general heaviness in the body and limbs. It also leads to fatigue and, most significantly, a thirst without a desire to drink. So, on the one hand, you feel thirst because of increased heat, but you don't have a desire to drink because of excess fluid. In general, it is considered that as the drink contains more alcohol content, it has a warmer nature. As previously mentioned, in small amounts, alcohol can supplement and move qi and blood. So, for many, this topic might be controversial, but as you see, the alcohol usage the medicinal usage of alcohol in China has very wide and long history, and even now in China, even in the society and to the mere people, it is widely used. So I hope that we can use it moderately, or not use it at all, or just use it as medicinal and medical usage, especially if you are acquainted to Chinese medicine, and which I support greatly. Thank you for listening, and hear you next time with love and light. Until next time. TCM Podcast, all about Chinese medicine.